applying it to them. Alright, so I'm ready to give all the treatment onto the calf itself. So before I start off with that, I'm just going to apply a little bit of gel onto the calf muscle, and then straight after that we're going to do a bit of treatment onto the Achilles tendon. So I'm just going to use regular ultrasound gel and just give that a good bit, especially the more hairy the person is, the more ultrasound gel you need to apply for the shockwave to actually penetrate into the skin. So I have the machine all set up and ready to go. I'm just going to spread out the gel before I begin. So the machine is all set. Gonna get that going. So once again, as I said, I'll just sort of get the machine ready, start it off, let it have a few beats there just so that the client can get used to that, what it sounds like. And then I'll actually switch it on before I actually apply it directly onto the skin. All right, so here we go. So as you can hear, it's pretty loud. And all we want to do is we just want to keep moving the applicator head through the structure that's actually being treated. And seeing that it's a pretty big calf, there's a lot of surface area that we need to cover. So at the moment the bullet's actually firing through the tube, it's hitting into the end plate, and then it sort of spreads the sound wave through the gel and then into the muscle itself. Now the client might experience a few different things. On certain of the trigger points, I would actually be able to see some of the twitching in the muscle as it actually hits onto the trigger point, or the client might also say, well, that's a very sensitive area. So just obviously be cautious that you're not applying too high an intensity on the first session. And necessarily, depending on the tolerance of the client, then you'll have to just increase or decrease the intensity of the shockwave itself. So going a little bit into the Achilles tendon here at the moment, and then into the muscle belly itself. And then in between, you'd also ask the client, so how's he feeling? Is he able to tolerate that? Do you need to set it up higher or lower, depending on how much they can tolerate? So almost there, a few more to go. And that's the application of the shockwave into the calf muscle itself. Now if I had to zoom in a small bit, you definitely also see how red that area is just with the amount of blood and oxygen being put into that.